Hi, my name is Cynthia Lewis, and this is about evidence-based medicine for informatics INF355 for Northern Kentucky University. Evidence-based medicine, is also known as evidence-based practice, is how we get that medical research into our daily patient care guidelines that we use every day with patients. One of the best definitions that I came across in doing the research was by Whitley. He said that evidence-based medicine was the conscientious, explicit, judicious, and reasonable use of modern best evidence in making decisions about the care of an individual. Well, in this segment, I'm going to cover three areas concerning evidence-based medicine. One of them are the sources of evidence medicine. Second, some of the challenges that we have. And third, the ways to overcome some of the challenges. Well, as we just talked about, evidence-based medicine is a way that we can get medical research into the hands of medical practitioners, nurse practitioners, nurses, doctors, so that we can update our clinical practice guidelines that we use in the care of patients day to day. So some of the sources of this information, number one, the most prevalent source is scientific journals. We can get these through our electronic search engines such as, Ovid, Medline, ESCO, PubMed. We can also get these from knowledgeable, experienced experts in each of the fields that we're looking at. Some other sources are medical textbooks and also government and professional groups who put together training packages for the field also. So what are some of the challenges? Well, right off the bat, we know that one of the biggest challenges is just time. Do you know that a typical nurse practitioner, doctor, medical professional would have to read 19 articles every day just to stay up to date on what is going on in their field? Well, obviously, that's not going to work. Even if they could read 19 articles every day, there's an issue with, picking out the good information and deciding how to implement it into practice. Most nurse practitioners, doctors, medical professionals only have 1 to 2 hours a week. Some other challenges include the study data itself. A lot of the studies out there don't use randomized control trials, which means a good basis for being able to reflect or generalize the results to the general population. They don't use random diverse population groups. And also you need to realize that you're going to need more than one study to base your findings and changes on. Last, bias. A lot of these research projects are run by government agencies or even pharmaceutical companies, and sometimes the data can be biased. Sometimes all the data is not present. Some of the treatments were stopped early. Some of the adverse effects were not shared. So we just need to be conscious of this as we look at the data. So some suggestions on how to improve. For one thing, we got to evaluate the data. There are several methods out there that we can use to determine good, incomplete data that we should use, shouldn't use. One method is called the hierarchy of evidence. It classifies data 1 through 4 level. Level 1 is data that we can use. Also, when you go look for data, target a more specific targeted subject area as you look for data. That can help maximize and make your time use more efficient. And lastly, we gotta use our information technology, our health information technology systems in a better way to make it more efficient for nursing, doctors, nurse practitioners, all types of medical professionals to get their hands on this medical evidence that we have out there. That's the only way that we're going to be able to get the medical research, changing the clinical practice guidelines, and in use on patients so that they get the best patient care. Again, evidence-based medicine is just how we get that medical research that we have into clinical practice guidelines so that we can use it to get the patient the best care possible. Thank you.